All right. Hello, everyone, and welcome to our webinar, Mental Health, Wellness, and COVID-19 Pandemic. We're so glad to have you. This webinar will last for 1 hour and 30 minutes, and we will have space for a question and answer session. I would like to go through a few housekeeping tips for you to navigate this meeting as smoothly as possible. If you have a question for the presenters about the content of today's presentation, please write your question in the question and answer box at the bottom of your screen. This will allow us to ensure that all questions get answered and stored in the same spot. We will do our best to answer any questions as we proceed through the webinar today. If you experience any technical difficulties, please send a message directly in the chat box to me. All right, I am Gracia L, and I am the Health Liaison for Mid-Missouri Black Nurses Association. I'm going to turn it over to our president, Felicia Ananobi.
Hello, everyone. Let me share my screen. Just a minute, sorry. I'm having technical difficulty here. So sorry. Hello, good evening, everyone. Oh, are you not seeing my screen now? Sorry, I don't know what happened here.
Just give it a second, maybe.
Yes. Okay. Can you see the screen now?
Yes.
Okay. Okay. Good evening, everyone, and welcome. I will introduce the panelists now. And on the panelists are LaSonya Dunbar. She's a mental health nurse, works at St. Mary's Hospital here in Jefferson City. And the next is Jennifer Thomas. She hasn't joined us yet. She's a licensed clinical social worker who works with Central Missouri, Community Health Center of Central Missouri in Jefferson City here. And we have Dr. Kesinga Dan, who is a licensed professional counselor and associate professor and director of the counseling program at Stevens College. He has 2 decades of clinical practice, which includes positions in public and private community and mental health, higher education and private practice settings. So I will let them talk more about their experiences. Our next panelist is Dr. Gracia Nabhane. Dr. Nabhane graduated from St. Joseph Medical School in 1991 and is an had her internal medicine residency at the Cooper Hospital in New Jersey. She had her fellowship in pulmonary critical care medicine here in at the University of Missouri, Columbia, here from 1993 to 1996. And she's a board certified pulmonary medicine doctor and sleep medicine doctor. She also has been working at Capital Region Medical Center for more than 2 decades. Then our next panelist is Dr. Tashel Bordere. She's Assistant Professor of Human Development and Family Science and State Extension Specialist in Youth Development at University of Missouri, Columbia. She has published a lot of articles. She's a thanatologist, which is she deals with death, dying, and grief. And she has written a lot of, she's had a lot of publications and researches in this area. Our last but not the least panelist is Steveny Grieve. She's a family nurse practitioner and acute care family nurse practitioner. She's board certified and she works at Boone Health, Columbia, Missouri, and she takes care of COVID patients in the ICU and sees the effect on the patients and their family. Thank you and welcome to this webinar. I will now turn it over to our moderator for tonight, who is Raisa Ame, our health liaison for the Mid-Missouri Black Nurses Association. I would mention also that Steveny is our membership chair in our organization, the Mid-Missouri Black Nurses Association. Thank you all and welcome to this webinar.
Welcome, everyone. I'm so glad that you all could join us today and bring your experiences that you're seeing in the mental health capacity. I'm going to start it off by having everyone go ahead and provide their introduction to our attendees and also share or provide a small summary of what you're seeing in terms of mental health and COVID-19 in this year.
Hi, everyone. I'm Steveny Grieve. I'm the nurse practitioner, work at Boone Hospital in the ICU. And for tonight, I just want to share with you guys just what I'm seeing in the ICU right now. So our active COVID cases have really gone down significantly. However, we're seeing a lot of post-COVID syndrome patients, right? So these patients are coming in and they have this generalized malaise and fatigue that they just can't get over, right? Their families are stressed, they are stressed. Some of them now who used to not wear oxygen has to rely on oxygen. Others are now got a tracheostomy, which is a tube that goes into their throat to help them breathe. They're used to able to, go grocery shopping on their own, take their kids to school, be able to do activities with their families. And this is just not happening because of the effects of COVID-19. So tonight, I just want to talk to you guys about that and just, reminding everybody that COVID, it just doesn't affect our lungs, it affects our mental health and it affects our entire family as well.
Hi, everyone. I don't know if I go next. Is that okay? Hello, everyone. I'm Dan Kissinger. I'm the director of the counseling program here at Stevens College. And I feel a little bit out of place. I don't have the kind of direct experience that a lot of you have. So I'm going to just kind of share what I've seen at kind of on the academic side of things on campus with students, things like that. I certainly would just build on what was just said in terms of how it affects just the person holistically and the family. One of my roles is the director of the counseling center here on campus. And so over the course of the last year, I've only been here since all this academic year, but we've seen a steady increase, as you might imagine, in students that were coming in initially with the typical relational issues and things like that. But as the word got out that the counseling center was open again and was seeing people there, we've seen a steady increase in the number of students coming in with anxiety. They often don't frame their presenting problems, at least on campus, as COVID related specifically. They frame them as more systemic, relational, trauma oriented, eating disorder. The range of things that you see have been amplified in many cases by being isolated and not having the same kind of connections or being home and doing all their classes online. So, and I'd be interested when the other academics, if that's what you're kind of seeing, we're seeing it in the classroom a little bit, which is all Zoom, of course. But I've seen starting in the fall, really it changes. We've seen people were very engaged initially. They'd be sitting in their desk at the, paying really close attention. As the year has gone on, I notice now, and I don't say much about it because they're just trying to keep people kind of between the lines so they can finish and focus. But I've seen a lot more people or students, with a, hopefully not alcohol in there, but drinks or eating or sitting on their bed versus sitting on, and I've seen a lot of their pets are with them now, so a lot of comforting things that I've noticed as they just try to cope as this has gone on. So, we've seen the anxiety and the depression that are consistent across the board. The studies, there's one study from the CDC that notes a 200% increase in anxiety and depression, kind of nationwide. So it's absolutely out there. It's got its own unique flavor. Well, idiosyncratic as that is on campuses with students. So it's just everywhere. And so it's a little different version of what probably the rest of you, certainly the rest of you experience on a day-to-day basis. But it's certainly impacting everybody. Thank you.
Thank you.
Hi, good evening. My name is LaSonya Dunbar. I'm a nurse at St. Mary's Hospital, and I've been there for over 30 years, and I've seen a lot. I originally started working in med surg. My love was in psychology. I graduated at Lincoln University with a bachelor's degree in nursing / the bachelor's degree in psychology. I had started at the University of Missouri and went for a semester, and then life changes happened, and I never got back to it. I spent the majority of my time working on mental health. We've seen a lot of changes. At the beginning, I don't think the nurses took it seriously. Some of the nurses did, some of them did. It's just depending on what your beliefs were. And I'm always a little bit skittish. So I just took off for 2 weeks. I thought, I'm gonna take off for 2 weeks to see where this goes. And they were like, I don't think that's necessary, whatever. I'm like, well, I had been sick the year before, and I got septic. So I was like, I could be exposed to this right now until I kind of get a handle and wrap it around my head, because I was concerned. So when I went back to work, my doctor asked me, what do I need to do? I said, just tell them I need to wear a mask. This was before the hospital required wearing a mask. I said, this is serious. So that was without I wore a mask. About 2 weeks afterwards, then it was mandated. And this was like in March, that everybody has to wear a mask. And then, all the other stuff came after that. And then it got more serious. People start, the staff that I worked with would start taking it more seriously. And of course, some people still think, oh, it's just like any other, disease. You get better. I'm like, no, this is different, people. This is different. So it was really difficult to try to get your coworkers to believe that this is more than just the flu that we had in the previous seasons. So you had to convince the patients, you had to convince your coworkers. And then finally, when it was a mandate, everybody seemed to get it. And we have to go through all these different, taking our vitals and all these different things. And writing a note that you had to wear a mask prior to that. Then afterwards, everybody was wearing a mask. Then with patient care, we had patients coming in with COVID. Then we had to do different tests. We had the antigen test, then the PCR test that was more reliable than I think the first COVID test. So we would have to, it was really a stressful moment where we had to then take those patients and transfer them to a medical unit. And then at that point, maybe somebody else could have got infected. So we had to kind of deal with that. They didn't, but those are always the things that we worry about, safety. So then eventually we got tighten up the rules, and we had to have this person-specific test, PCR, which really slows up their admissions to the unit, especially when you get transfers from other units. It was very frustrating. So in order to accommodate, and few of the COVID patients got through, and it's very stressful. But eventually we were able to only admit them if we had a room and put them in a private room. St. Mary's have all private rooms in the hospital except for BHU. And if you're in mental health, we're always the stepchildren. So we have semi-private rooms. So we have to block off a room, which means we have to decrease our census to have that room blocked off until sometimes people somehow slip in or they'll send the patient anyway. And they're in limbo. You can't just leave them out there in limbo. And usually we'll make a bed form or put them in a private room on another unit, but it's really a lot of work in between that, a lot of stress in between that. So those are the kind of things that we've seen as nurses. But then we've had a lot of nurses that get sick and nobody seemed to want to talk about it at first. It's like, well, where's such and such? Where's such and such? And as a nurse perspective, I was a little disappointed that we should know that patients were, not patients, but nurses were being affected, infected, or security. We work a lot with the security guys, come up and bring the patients up to the unit. And there are a lot of people that I work with that did get infected. So didn't know it and then found out later, but I don't understand why we had to deal with why it was such a hush-hush thing. So that was difficult for me to understand. But I think it's affected a lot of people. I've known patients that I've known for over 20 years that come in, their husband have died, and I've known them. And, just, you see, both aspects of it. I had friends of mine, my daughter called me crying. I have a 23-year-old daughter that lives in San Antonio, that her RA died. She was only 26. And she just called me crying. And I was like, what's your name? Da, da, da. And it's really how 6 degrees from separation. Well, I know her her aunt, me and her aunt was in school together at Lincoln University. And I seen a post by my friend, like her niece died, and it was rough. Because I'm like, oh, I know her aunt and how it affects a lot of people. And I've really known a lot of people that have died from it that I deal with every year. We have, homecoming, and these are people that I've hung out with for the last 30 years that are now just gone. Sorority members, fraternity members. I found out recently some of my family members had it, but some of them got through that, didn't, die of it, but they had it. And my very best friend who took care of me when I got sick the year before that, she has COVID and she has the same symptoms that the doctor described. She has this malaise. She works in she's like a director in some type of conglomerate down in San Antonio. And she's like, I don't have any energy. She has all these symptoms. And then everybody thinks that she's kind of, faking it a little bit. And I tell my daughter and her husband, like, I don't think she's faking it. It's a thing. And the sad thing is that people don't have information on it earlier this year when she got infected in February. It's kind of like it's all in her head, and people are really not really understanding. Vast people think, well, if you just do this and you do this, it's going to be better. She's really having a lot of symptoms, and she's always been real sensitive to medicines. I think she got the, what was the medicine they gave her the first of the pandemic that Trump supported? It was called, I forgot the name of it. What was it? Yes. And so she had a lot of side effects from that afterwards, but it's really pretty traumatic. Lots of people have died. I don't know. It's getting a little bit better now. We're seeing less people. We've had people that have had COVID. We had to rush them out to the other units. It's affected our patients in particular because they can't have visitors. Now we're allowed to have visitors on the other side of the unit that only have private rooms because you can kind of control that environment. But so that's kind of difficult. So that sometimes we have to see them like everybody else on, face to face or whatever, Zoom or like that. But it's really, really been difficult. We've had our own staff that get infected and then their families get reinfected. And it's been hard. It's been really a difficult situation, but like the other doctor said, we are seeing less of it, and probably because we're in Jefferson City area. I don't know, but I know that it's still going up, and I hear people still dealing with it. But I think the blessing is in this area, Jefferson City, since it's a smaller town and we're not probably crowded as most metropolitan areas, we've been able to kind of get it under control now. But it's just getting people to continue to get under control with it, because sometimes I know we're relaxed because we just tired of it. Yeah. So that was my experience with it.
Thank you so much, LaSonya.
Thank you.
All right. Are you trying to speak, Jen? I'm muted.
Oh, here I am. Okay.
Okay.
All right. If it's okay, I'll go ahead and go. My name is Jen Thomas. I am a behavioral health consultant for the Community Health Center of Central Missouri. And basically what that means is I provide a lot of support to our medical staff. I help with not only mental health needs, but if people are wanting to make changes with diabetes, smoking cessation, there's lots of different stuff that us behavioral health consultants do. So I'm just going to briefly talk a little bit about some of the things that I've seen in the clinic. Like most everyone else, we saw an increase in anxiety and depression. Interestingly though, folks that were dealing with things like social anxiety, oftentimes the isolation was kind of like a breath of fresh air in the beginning for some of those folks. But now that we're thinking about, restrictions being lifted and people are starting to get back out and engage with folks again, anxiety starting to increase. Also, some people who didn't have any of that kind of anxiety before was starting to have anxiety now. They haven't been around people for a long time. They're like, how do I re-engage? So there was a lot of anxiety with those kinds of things. Also had a lot of patients in the beginning that had some of those diagnoses already that were very reluctant to seek medical care and mental health care. There was just a big pause. They were afraid of contracting it, and being in a medical setting as a therapist, people knew they had to walk in a medical setting am I going to get exposed? They're seeing people wearing the masks and the shields, you know, it's just a lot. One of the speakers earlier was talking about, you know, grief and loss. I think that is a huge, huge point of COVID. It's not just that one person as an individual experienced loss. This has been like a huge collective, national, global experience. I've had patients that have had more than 5 losses due to COVID over the last year. And when we then add that on to, oh yeah, and my friend lost someone, and my coworker lost someone, you know, it's so far reaching, that grief, that collective grief that people have been experiencing. I had one patient in particular, his wife contracted COVID and she died. And then his brother-in-law contracted COVID and died. This was in a few months period. And then he had a stroke, the patient did. And as a result of that, you know, now he's trying to figure out, how do I survive on my own? He was at risk of losing his housing. He couldn't go back to work because of the effects of the stroke. It was just such a greater magnitude than I think any of us ever realized these things would be. Looking at, you know, some other parts working in primary care, we also have OB, right? And I've had women coming to me, you know, coming in to get their ultrasounds done and feeling sadness and grief because their partner couldn't be with them to make that connection and see the baby with them on the ultrasound. A lot of women talking about that. I had women sharing that, you know, just going through the birthing process, right? We get excited. We have this idea about what it's going to be like, who's going to be there, who's going to hold the baby. And then realizing, okay, maybe only I can have one person with me. It's a lot. It's a huge shift that people have had to make. A lot of the teenagers that I work with, a lot of grief and depression there too, just loss of sports and activities and clubs, that disconnection from their social environment, which we know is huge for adolescents. So yeah, what I'm seeing now, people are getting a little bit more comfortable, thankfully. People are starting to come back into the clinic. As a therapist, I miss seeing my people in person. I just love my humans and I can't wait to get them all back. At the same time, I can also see that COVID in some ways has been a gift for us in the sense that it's really pushed our telehealth. And I have patients now that I can reach that are in these far rural communities that might not have been able to seek mental health services before. So I try to look at the growth in the midst of this pandemic because there's some of that too. And I'm so glad to be on this panel and talking with all of you and knowing that there's been this additional shared experience and knowledge that we can bring. So thanks for having me here.
Thank you. All right. Does anyone else want to share? Oh, Dr. Nabhane.
Well, I can say a few words, if I may. I'm a pulmonologist. I also work in the ICU, and I'm mostly my practice is sleep medicine and asthma and outpatient. But of course, you know, during the pandemic, we had to take care of people in the ICU, and of course, it took you 15 minutes just to get the gear on, just to go in. And then luckily, a lot of my patients made it, but we had to lose a few, and that was hard. That was hard to take on the patients, on the nursing staff who were there a lot more hours than we did. You know, we rounded, we you know, we did our stuff, but the nurse who was there, you know, 12 hours in a row and then came back the next day. And so that was really hard on the nursing staff. And of course, not having family around to see them or to hold their hand as they were passing away, that was very hard too. November was a hard month. And after this, you know, it slightly got better, and thank God right now it's a lot better. But we all felt it. You know, you may not have lost somebody really close to you, but like Jen was saying, this collective grief was everywhere. The anxiety of so many people being called out because their children were exposed, and so they had to take them home and quarantine with them. Is so many disruption. I don't know one person whose life did not get disrupted. You know, I'm lucky my kids were older and they were working, but many moms had to not only do their jobs from home, but also take care of their kids and do their homework and help with cooking and, you know, the whole household operation on top of holding a job. That was really tough. I've had grandmas crying in my office just because they miss their grandchildren. They haven't been able to see them. And they would tell me, it's not a money thing. We have everything. Nothing has changed. I don't even have to go to work. I'm retired, but I miss my grandchildren. And so many of these stories. And honestly, I don't know anybody whose life has not been affected by this pandemic. Traveling cancellations, and for some of us, it was really easy to switch to the electronics and the Wi-Fi ability to connect with people. But these old folks, all different people, had limitations to how many people could be on the internet at the same time at home. Not every home had not every region, you know, had, you know, were centrally located to where they could get good, strong Wi-Fi or fast Wi-Fi, etc. I've had dads complain how their kids were bickering and not listening to anybody and were unrowdy. And, you know, we took it for granted for so long that kids went to the school and, you know, that they socialized there and they played during playtime, and then they came home and we could maybe tolerate them better, or, you know, it was different. And so that year has been tough on a lot of people, on most of us really. And I don't know that anybody did not fight this COVID their own way. I mean, a lot of people got sick, a lot of people helped take care of sick people, and a lot of people just helped, you know, their own way. What else? You know, I'm happy that we have the vaccine. I'm happy that, you know, millions of people have received the vaccine. I'm happy that we have an effective and safe vaccine. Several, actually, 1 or 2 at least, that are emergency use approved by the FDA. Yes, it was done fast, but so far they seem to be effective. The CDC has told us so. You know, they may have side effects, but that's expected. These are normal. It takes 2 weeks after a vaccine to become immune, and that's a lot better than any therapy we've had so far. What else? You know, I'm happy that the vaccine are much more widely accessible now. Any Missourian can get it. I keep directing my patients to either the mall here in Jefferson City or to Hy-Vee or to whatever centers, you know, that they can get vaccinated at. Anybody 16 and older is eligible now in Missouri to get the COVID-19 vaccination. And hopefully we'll be able to do things that we could not do before getting vaccinated. Yes, we still have to wear a mask, but that's a very small price to pay, you know, considering what people have been through. And, you know, in one important thing I'd like to mention, we all think that, you know, COVID only kills certain people, right? You have to be above a certain age, you have to have a certain comorbidities, you have to be, you know, I don't know, obese, have asthma, have diabetes, renal failure, immunocompromised. I am here to tell you, we have witnessed younger people, healthy, otherwise not immunocompromised, die from COVID-19. So for those of us who thought, I'm invincible, I can get it and be good, I can, it's not worth getting the vaccine. It's not, it's a bunch of baloney. This does not exist. This is just the flu and I can get over it. That has not been the case to many of my patients. I've had many elderly people survive the vent, get off the vent and do really well. And I've had younger people die for no reason except getting the virus. So if you have a chance to get the vaccine, if you have the chance to tell somebody to get a vaccine, it is safe and effective, and I really hope more people get it than not. And of course, I want to thank everybody for inviting me today. I feel privileged to be among these smart people to share their experiences and give my 2 cents worth. Thank you.
Thank you, Dr. Nabhane. We're glad to have you.
Thank you. So I'm a qualitative researcher, so I did a lot of listening and reflecting because I'm like the death grief person on the call. And so the perspective that I bring to this is I don't do direct service with nurses. A lot of my work is centered around, sorry, my microphone might be too loud. Let me see. Apologize. Adjust that really quickly. How's that? It's okay. A lot of my work deals with looking truly at social justice issues around loss and grief. And really that includes everybody on this call because we truly live in a society that is pretty death denying or thanatophobic, we like to call it, and grief denying. Largely due to capitalism, the goal is to keep going, keep pushing forward, which is why some people are stressed about the anxiety of being centered and staying in place during COVID. Not have some people are bothered by that just because of personality, but other people are wanting to push forward because that's how we've all been socialized. We've all been socialized to just move forward. We have very little education around death and loss. We know, for example, that and I also mean non-death losses, which is something that kind of resonated across everything that each of you mentioned. It's just these other non-death losses, loss of energy, loss of the you before COVID that existed, right? You described the fatigue, the people with the post-COVID syndrome, if I'm saying that correctly, the long haulers who are coming back with some very visible changes, but many invisible changes. And just keep in mind, you all, as we think about our mental health, if the broader society won't acknowledge or has a hard time really even checking in on you when you have a death loss, just imagine how much society will disregard your non-death loss. So what we're seeing is people, and this has existed long before COVID, people with brain injuries, people with a lot of injuries that people cannot see are often, with these profound life changes that are ambiguous or will be prolonged, if not lifelong, contend with communities, workplaces, families, even in other spaces where if I can't see it, it doesn't exist. So we will see some challenges. We will see challenges. Well, we do see challenges for people who are newly dealing with adulthood, major shifts to their lives, like the inability to parent like you had done, and do your job as effectively as you did before. You're a smart person, but now you're too tired and you're on oxygen and you were healthy. So I know we tend to think, so the death loss has been profound and we've seen those numbers, right? In the media each time, but we see less attention to these non-death losses, these invisible losses that you all are describing, and Steveny kind of got us started with that, but I've heard other people mention it. And so I want to highlight, I guess, just clarify when we talk about mental health, and in my area, it's grief and loss and how people cope with that, and the lack of resources in many spaces and places for dealing with these losses, right? The impact of COVID will be long lasting, whether it's the oxygen or the mental health challenges, this anxiety, newly, like Jennifer talked about, this new anxiety about You know, I was a social person, but now I'm actually, I'm a little bit afraid. I'm a little hesitant to get back out here and, you know, re-enter the world and what that will look like. So I want to highlight that death and non-death losses both are sources of grief and bereavement for people. Now, again, a huge barrier around all of this is that we don't talk about death and loss. Because we don't know what's next, so we have guesses about what's next. And so, my heart, I really am thinking about the medical community and medical staff. I'm here in Steveny, for example, and I'm thinking about all of you who are in these, LaSonya, in these spaces where you're trained to save lives, not to, you're trained to save lives, and you yourselves probably have very little education around death and loss. That's like a new thing. I do it on MU's campus where I'm a professor, and it's like a new thing, right? To have that much time because you're trying to do all this other coursework. So you don't have a whole lot of training with that around death and loss and grief, because you're here to save lives and avoid some of that grief, right? You're supposed to save us from all of that. And so the helplessness and mental health challenges for people who are right there on the front lines witnessing all of this. Funeral directors on the front lines, just like physicians, right? But we don't see them in the media. So if you're on this call, we honor and we see you too. The teachers, like all of these other people who have not had choices and are charged with leading communities, who have been on the front lines along with you, trying to serve many different communities, who in addition to death and death and non-death losses, even the inability to have the funeral you thought you wanted to give your person, right? We see increases in choosing cremation, right? I will highlight that a lot of my work is with marginalized populations, and in particular Black communities, and I've also studied rituals for Black communities. So for everybody, these rituals have shifted, but for communities, for example, Black communities who kind of spare no expense on funerals, even if you don't have the money. Because of all of the injustices in this life, you want a life, you will give your person the best send-off that is humanly possible so that they feel valued and that you feel, your person was valuable, to have to cremate them because it's less expensive and you can't get there anyway and make these difficult choices while still paying a lot of similar fees. So the financial, just a whole lot of intersecting losses that are happening at the same time. To people, lack a sense of control. So all of those different variables contribute to it. I also heard, as I want to pull this into loss too, because oftentimes people talk about trauma, but they don't talk about loss and grief. But they're interconnected, y'all. There is never trauma. There is loss without trauma, but there is never trauma without loss. And if there's loss, there's grief. Grief is separate. The definition of grief is really this separation from something you're attached to, whether it was your ability to walk, to be there for your kids' activities, your career, and even attachment to pets and family members, right? Attachment to yourself before this happened, right? We live in a society that gives us little space for liminality. There's not much space to just sit and figure out what's next. COVID has allowed for some of that, right? There's been actually a lot of space to sit and think about what's next. Like, how do you want to come out of COVID? But we haven't also had a whole lot of experience with being able to sit and think about what's next, right? So we've been challenged on so many different fronts that really compromise our ability to cope with what's going on. One other thing a couple of other things I want to highlight is, so the cumulative losses that are occurring. So there's the death, the non-death losses. And I also want to season that with the notion that a lot of these losses have been co-occurring and coexisting. So for me, you can never talk about the pandemic without also talking about social unrest. We can never talk about the pandemic without also looking at, they're intertwined for people. They're never separated. I can't separate my arm from my leg. So I also want to invite and make sure that that's also a part of this conversation, that the youth I've worked with, myself, from my own social positionality as a Black, or identify as a Black woman who studies loss and grief and does this for a living. It was very taxing to do research in the area, to research trauma and loss and violence while moving through this period of COVID, and then watching the death disparities due to pre-existing healthcare disparities in Black and brown communities. And so that needs to be a part of any conversation that we're having when we're talking about mental health. We've all been impacted, but we for sure have been differentially impacted by these ongoing historical, historical and present day losses that are particularly afflicting racial and gender marginalized populations. Somebody mentioned women and mothers leaving their jobs, and that's also related to inequity. A lot of these women did not want to leave their jobs. And it's not the women's place in the home to raise kids, unless that's your cultural belief. But many women have resented it and have been disproportionately impacted by the loss of their job. A concept that I developed around the disenfranchisement of populations is suffocated grief. That's one other thing I want to make sure we leave with, because here's my deal. I want to make sure you know your rights and that you're equipping your the people around you with their rights around loss. I'm glad to send you information, things I've written. I refer you to other people, but knowing your rights around loss is really central to coping, right? Being able to name your experiences. Can everybody right now say, I'm grieving? Yeah, I'm actually to unmute. We need a quiet chorus of this. Unmute.
Yeah, sure.
I'm grieving. Everybody just the words 1, 2, 3. I'm grieving.
I'm grieving.
Grieving.
Yes.
I'm
So,
grieving.
so being able to name it and name it again and name it again and name it again until somebody listens and hears. And believe it or not, that will be empowering for people who are in your presence, because they see you as authority figures, right? You're a nurse, you're the doctor, you're the counselor. When you can validate that and be their social mirror, people do better coping when they can name what's going on, right? Or they have an answer to their experiences. So being able to say, wow, you're dealing with co-occurring losses right now. You know, we see what's happening with COVID, and the backdrop of COVID is just these historical experiences with police fatal violence, with community violence, with sexual assault, when abuse, domestic violent rates are increasing. So because families are more isolated. So there are a lot of social ills, not to make us depressed, but when we can name them, we can better serve families, right? We can better serve ourselves, take care of the caretaker, and then you can take care of the world. And there hasn't, again, been a lot of space. So again, a shout out to everybody who's been kind of on the front lines of this work. I heard somebody mention you're watching people die at these unprecedented rates and having to get right back up and go back and do that same thing again, right? Because it's not even built into the system of hospitals, which is really which we'll come back to that, but policies need to change in terms of mental health. Some hospitals have done that well, and others have not. Again, capitalism, come make my money. No time to be grieving and holding your head down. And so trying to factor all of this in to people's loss experiences. So again, I tried to tie in some things that you say and give grief and loss language and meaning around them. But as long as we don't have some answers to things, and we live in this state of ambiguity with COVID, and will we still have to wear masks? And it changed, today we can, tomorrow we can't. It's going to be challenging. We also challenge when we have to deal with things that are ambiguous. We want answers, right? Aren't we trained to know that? Kindergarten, have the right drawing. Don't bring me a stick figure, that stops being cute once you're 5 or 6, right? And so people drop off even with their family drawings. So people want you to get it right. Standardized tests, and it's our socialization. So ambiguity, not knowing, helping people to be able to, again, name your experience and just say, I don't know about tomorrow, but for today, I'm going to, pray if you're religious. I'm going to check in with myself. I'm going to eat a banana, have some water. Hydration is key. I'm going to get some vitamin D and just go outside. I'm going to contact my therapist because she or he is available now. So all of these things that have been mentioned, but you got to take care of yourselves too, people who are, again, on these front lines, parents, all of those folks. So I wanted to bring that in and really help us really grasp about all of the complexities that really tie into this thing we're calling the pandemic. And then social inequities are so key, and that we can name groups, y'all. We haven't named the population very much. I was so happy to hear the word rural, and we got to say the word Black, and we got to say this is impacting women. Oh man, this is impacting teenagers. Like we have to also be able to name that. If you have a client who comes in or a family who comes in, being able to say, I know today was difficult for you as a teacher, because you're dealing with if a child is visibly, or somebody's verbally expressing or seems off on the day of a police shooting, then we got to check in on them, right? We have to name these things that are happening. We don't have to be experts, but naming them reduces some of this isolation that we've been talking about. My final word here about this is so as a professor, I've shifted all of my assignments to relate to kind of self-reflective activities. I did it before COVID, but it's so essential. Their own experiences with not being able to get a job. They needed to be heard and seen and honored with that. And so I made all of those shifts to come. I didn't wait for them to come to me or express an issue. I know we're in a pandemic, and almost every time I write to them, I say, y'all, I understand we're in a pandemic. I know society is trying to move forward super fast. You got to move at your own pace. And we are still in a pandemic, and we are still witnessing all of this violence in the media and in communities. And we got to take care of ourselves, but we have to name it. So that's some of my 2 or 15 cents.
Thank you, Dr. Bordere.
Sure thing.
You brought up some very important points, such as the racial inequities and then the social unrest. I've noticed throughout the presentation, there's been some common themes of ambivalence, anxiety, depression. What are your thoughts, everyone's thoughts, in terms of how folks should deal with disturbing information that's coming in through the media, such as that new variant that is in India? What kind of coping mechanisms would you suggest to our audience in terms of dealing with that? Do you recommend them holding off on social media for some time, taking breaks from watching the news? What are y'all thoughts?
Yes, I'm glad that you brought that up. When I am in the clinic, typically even once COVID began, and as we've been moving through things, I've tried to have patients, at least the ones that are a little bit older, compare it to when we experienced 9/11 and how we just got filled with so much media content and how impactful that was. And the importance of setting limits, taking breaks from how much media content you're taking in, reaching out to professionals that you know that can give you accurate information. We know, especially with youth, there's just so much information out there. Not everyone is educated on, what is a reliable resource. So I think that's been helpful to a lot of patients. I've told many of them, set a time for 30 minutes a day that you're going to watch the news, because I said, usually it's going to be repetitive. You're going to hear the same thing over and over again if you're watching some of those main channels. So setting up some limits. Yeah, that's what we've been doing.
I would second that. I think that's really wonderful advice. I think I continue to be, I shouldn't be at this point, but I continue to be shocked by what is shown on newscasts. A video over and over again to Jennifer's point of people being shot and killed, and especially recently. I mean, I build on what Jennifer said, and I try to instill a sense of, okay, the social media, of reducing that and being very intentional in what you do. But also, reality testing, of, okay, don't, get reliable information, instead of Facebook, you're looking at, a talking head in some particular newscast position, is talking about all these conspiracies or what ifs or things like that, versus I try to direct people, we're going to get evidence-based information and to funnel people to the CDC or, another reliable source where there's evidence-based data that they can look at in terms of, reality testing what they're hearing in other places. So I really try to do that as much as possible.
Thank you, Dr. Kissinger. Anyone else want to share?
I want to say something really quick, again, related to loss. It's like, related to your comment, Dr. Kissinger, and actually to both of you. sorry, I've had a super long day, super long day. And I also have an invisible injury. So I just need, this notion of these repeated images, right? We want to limit, but you know, it's challenging for some populations to not be a part of it, because then they are also looking for how they might get involved, right? And then we are going to be more likely to see these images of shootings of Black people, because the goal is to objectify and sensationalize those deaths, right? It's newsworthy. And so that's also something I try to impart. It's like this is newsworthy. It's to create these other divisions that will also produce grief for you, right? And add to your anxiety on a daily basis. So kind of naming that too, right? We don't show any other we don't show any other person being killed in the media except Black people. We will watch them die right in the middle of the street and continue to film while they lay there. And so keeping that in mind, that's another thing to kind of name when with our clients and people in our spaces. And it also is, again, it's a whole nother level of a source of grief for populations who understand that this doesn't even happen with other people. So thank you all. Those were great. But I agree with Jenna. I can't say your last name. Thomas. Okay. I should have put 2 and 2 together. Yeah. Thank you. Your comments were incredible too.
Thank you, everyone. So it looks like we have some questions coming in from our audience. One of the questions we have is, how is stable defined when speaking to the family members of COVID patients? This person indicates that their niece is critical with COVID in Ohio. As a nurse, I know how to explain stable, but to lay people, it sounds as if a person is improving, but labs could stabilize, but breathing could be worse. Should the term stable be used?
I can take that question. So stable it's really, we have to be careful of the words that we use, because stable could mean that their oxygenation is not worsened, in the sense that if they're on the ventilator, they might be 50%, they're not up to 100%, right? And they've been kind of sitting right at 50, 60% for maybe a day or two, as it relates to maybe medications to keep their blood pressure up, right? Are they having to, get a line in so they can be on medication that can keep their blood pressure up? Or is it that they're able to maintain their own blood pressure, right? What does their labs look like, right? Is their kidneys starting to fail now? Or, is it that the kidneys were failing, but now they're doing better? So it's really important to explain that we are looking at multiple things. We're looking at the person's lab information to see if those are actually improving, and if they're now at a rate at a part in the clinical process where those labs are now just stable, in the sense that they've not gotten any worse, or they've gotten better from where they were. Again, oxygenation status, if the oxygen requirement is worsened, or if it's just kind of relatively sitting at an acceptable level, right? So I do understand the pain that participant is feeling, having somebody in the ICU and not being able to be there, and not being able to really get your loved one back in the condition that they were before COVID. So I would say at this point is just to keep listening to the doctors, and ask questions that they can explain in layman term. How many days are we looking at? They might not be able to tell you that, okay, give us 5 or 6 days, but having just some relative information to say, our goal is going to be tomorrow, or in the next 2 or 3 days, we want to see that her oxygen requirement is now down to 40%. And we're able to wake her up some and have her respond to us, and make sure that her mental faculties are still there. So it's really, really tough, but those are what I would do, is to get more information and just have them to level with you and be honest, right? Because if you can't get your providers to be honest with you and tell you exactly what's going on, when the real end of the rope comes, it's going to be a shocker, and it's going to be even worse to deal with it at that point.
Thank you, Steveny. Anyone else have any additional input? Okay. All right, it looks like we have another question from our audience. What is your recommendation for children that are afraid to leave the house because they keep seeing kids being murdered in the street? How do you help them or calm their fears?
I'm glad to take that one. My specialty area is homicide loss and Black youth. And it's very challenging, and I want to acknowledge that first of all, because there is ongoing loss, not only by people who look like you, but by the people who are supposed to be in place to protect you. So A is acknowledging that it is scary, and it is unfortunately normal for them to be fearful. It is actually protective for them to be fearful, and we find that Black youth tend to be particularly in high violent death rate areas, show more hypervigilance. They're more right on high alert because they have to be, a serving a protective function for them. Some things I would recommend again are acknowledging their fears, acknowledging the losses that occur, and acknowledging the disparities, and then helping them identify safe people. Helping them, asking them what would help them feel safe, because safety for one child is not safety for another. Do they need somebody to drive them to school? Would that make them feel safe? Would having a cell phone and being able to call make them feel safe? So safety will vary based on the child. But there are real challenges. Honestly, there is not one thing I also would recommend is some support around grief and loss. Because that in of itself will also help them identify their thoughts and feelings. You know, the stories that are untold are the ones that people struggle the most with. So overall, y'all, want to say that please on this call, please check on the children. Please check on the teens. That's just an overall shout out. Children are more likely to hide their feelings from us. So it's a gift that this child has expressed that. I want to say that too. Oftentimes children will not show you that they're grieving. They look desensitized, or that's the stereotype placed on Black male youth anyway. But in fact, they're often trying to protect you from more worry and stress. Some people think kids are selfish. Sometimes they're not actually, especially when it comes to loss and trauma. They actually are more likely to hide their feelings from you so that you don't get upset, right? I know teens who will carry a gun so their parents won't have to deal with burying them because of some loss, and these are good kids. So trying to find support that is culturally responsive. Not every therapeutic setting is a culturally responsive one. So interview the therapist, figure out if the church community might be the space for that. So looking even at non-traditional methods, there are apps for it, but also there are real concerns around it. And identifying safe people might also be one part of the survival education that we have to differentially give to youth of color. I'm glad to check in if she wants to holler at some other point. We don't have a whole lot of time, but it's a big question, and it's an important one, and it's a huge concern and stressor for Black parents on top of COVID, and parents of color, Latino as well.
Thank you. All right, anyone else have any?
And the CDC finally has acknowledged that people of color, Black and brown, are at high risk of dying because of lack of medical care prior to COVID, during COVID. And that also goes to other issues, as you just mentioned. And I'm really happy that someone actually from a position with federal government, CDC, that high of a rank, mentioned that it's the number one, initiative, or one of the number one initiatives to look at that. And it took how many years to even acknowledge? Because people were just like, oh, well, So I'm glad to see that the doctor, I cannot recall her name, has made that initiative health concern for this year, as far as being treated, whether even on getting shot and even with healthcare. A lot of women have, and men and children have died that probably shouldn't have died in childbirth and mortality rates. So I'm glad that the CDC has actually acknowledged it after all these years, because we heard that for years and years. When you do your research, and it's like black and brown, black and brown. After a while, you go black and brown, black and brown. It's like, I can't, I'm surprised we're still here in America. And I'm not being mean or anything. I'm not trying to, but it's just, it makes you wonder sometimes. So I'm glad that initiative was put forth. So maybe some people start believing it, because it seems like no one will, sometimes people don't care. I know that there's a lot of people that do, but it needed to be said on a global, a United States level, so that people will start maybe waking up a little bit more. And that's just one of my concerns, and I'm glad that they made that initiative, because it's with healthcare, it's with education, and it's with violence and unarmed young people getting killed. And not to try to put the spotlight on me, but it's causes a lot of depression and anger. And then we're right back at the same thing. You got the same thing with the COVID. So it's just, everything is so, overwhelming sometimes. So we have to really kind of come together as healthcare workers, as people, as community, to kind of try to wrap our arms around each other so that we can survive in this United States of America, and the country also. You gotta love and help and put out a helping hand, all of us, to make it work for all of us. That's just my view on that. Thanks.
Thank you, LaSonya. Very important point. Anyone else have any additional input? Looks like we have a few more questions from our audience. The next one is, have you seen more patients with advanced directives, power of attorney, in the clinical setting? Is there more of a push for this documentation?
I can take that question. So in the hospital setting, as Dr. Tashel talked about, so a lot of people don't really like to talk about death and dying, right? I mean, our job is really to save lives. You come to the ICU and, my patients come in, they have little or no blood pressure, right? I'm putting in a line, or I'm intubating somebody. And so my job is to save you, right? Yeah. All the time. And so coming to talk about death and dying and trying to do advanced directive and trying to get, palliative care involved to be able to do symptom management and clarification of goals, that becomes a little bit problematic and a bit stressful for people, because, we want to live, right? And we get to the point where, we have this push and pull with another family member who wants you to give up, and another person will say, no, well, grandma got to live because she's got to be here to see the grandkids, or, and so we utilize a lot of our social worker to help to get, people start the conversation with death and dying and advanced directives and stuff. And I have to say that older people, I see more now with COVID, they are a lot more receptive to, that part of life where I've lived my life. And if I die, then I just die. But then there's a lot of people that are very resistant. So I'd say about half and half right now.
Can I add something?
Sure.
Can you guys hear me?
Yes, we can.
Yes. Okay, thanks. Okay. Anyway, what you said is totally true. I totally agree. Before COVID, we had many initiatives to discuss these issues in the office as an outpatient when there's no imminent risk of death. It's very hard to think of every possible scenario when you're already like your blood pressure is low and you cannot maintain, and your loved one is already in the ICU, and these decisions have to be made stat. So we found that if you discuss these, these issues, the options available, what it entails before, somebody is really sick, you had better understanding of their thoughts of what they would like be done. Do they want to go on dialysis should their kidney fail? Do they really want to go on pressors if the blood pressure failed? Do they want to go on life support or on whatever? So these are a lot easier conversations when the danger is not imminent. Once they are in the ICU, it's really hard to, because a lot of the physicians, excuse me, are not trained to hold these discussions. And yes, we do rely on social workers, we do rely on the ethics committee, or whoever is good at this to lead these conversations and get to mainly for us to be able to do what that particular patient wants us to do, like to really follow their wishes and not, twist their arms into one thing or the other, or depending on our views of what should happen. So we try a lot, but the best time to make these decisions and to fill out these papers are as an outpatient. And so we had started before COVID an initiative where every patient has to have advanced directives in the chart, just like you have your, your insurance card, just like you have your demographics, your address, the phone number. Well, you had to have advanced directives. Of course, with COVID, things shifted and changed, and so we were more worried about how they were doing and dealing with a lot of other things. But I hope this continues, because you're right, then it becomes very difficult when there's a near death, and now try to approach with all these important decisions. It's a lot. It's adding to the loss and the grief and the trauma anyway, that was my 2 cents. Thank you.
Thank you, Dr. Nabhane. Looks like we have one additional question from our audience. What are your thoughts on mental wellness and a 4-day work week for those who work 5 days per week?
Sounds really nice.
Yeah.
Can we all just agree that sounds really nice?
It does.
I think for any of us, I think something like that would be fabulous, but I can, for our clinic, that's not something that we're talking about right now. I don't know if there's other clinics that are doing things like that, or other offices, if anybody else wants to speak to it. I do think professionally it sounds great. There's lots of other countries and Europe and other places that do that. So I definitely could see that it would be a huge asset for folks. I have not had the pleasure of experiencing myself, but there may be other people on the panel who have.
I could speak to that. When I started working, well, I won't go to that. I worked 7 on and 7 on. That was way back in the 80s when they allowed you to do that. However, I only work 72 hours a pay period. So every other week I have 4 days off. And I think that's the only way I've kept my sanity. And sometimes I need to work extra, but I think that's the only thing that keeps my sanity. And some days I don't know how I make it because I got extra stuff, but every now and then I can pick up a 4-hour here or there if I need to. But I've really steadfast by doing that. I think that was my saving grace, because I won't get up to 80 hours. I won't lock myself into 80. So at least every other week I get a 4-day week, and that's how I survive.
I was asked once if I wanted to go to 4-day week. I felt better doing the 5-day week just because it suited my schedule better. But I do agree, every so often we have to make time to play, time to just go home and unload and change scenery and take a vacation, even if it was a staycation, even if, but no, I agree. Every so often people need to take off as much as they need to, just because it gets to you, and it's you need some time to just repair, to just, you know, get some strengths and get back, and, you know, maybe read a good book, or watch a fun movie, or, you know, do something to just change the routine of I don't know, that's what I do every so often, just to, you know, change. But anyway.
Yeah, it's worked well in a lot of countries. Again, I want to come back. So I'm not a socialist or anything like that, but it really is that this whole notion of we have to constantly be producing that is preventing this. And but quite frankly, how many of y'all are done by Friday? I mean, you're there and you're trying to, I'm not saying you take care of your patients, so you have to say that on recording, but many of us are Friday. Like, you know, be honest, like I'm not the same on Friday as I am on Monday or Tuesday. I'm like rolling, come talk to me Monday to Friday. I'm like, okay, I'm going, I'm pushing forward. But everything you just mentioned, really, you get better, you get actually better, more quality products when people do have a moment of respite. This, again, this liminality, this space in between, you know, no longer and not yet. So, you know, just think about it. I don't want to get this, I'm not the best at geography, y'all, but is it Spain where people get like a 2-hour, you know, you have lunch?
Siesta.
Yes, yeah.
Yes.
And look at, they're doing well. They look great. I mean, just have y'all been to Spain? Let me just tell you, you know, and so, yeah, there's that's just built into the day with the kids, with the, you know, and it's just a normal part. So it's kind of like, you know, there are all of these rules and policies, and it comes back to like, what's the policy and is it still working for us? And I'm hoping COVID will change that for people, right? That some, you know, some people will be now working more from home and that suits them, or we'll have some other varied options about how they maneuver in this world. So that is one plus of that. But yeah, good movie. Come on. That's how I broke my foot, by the way. I was trying to watch a good movie with my kid, and I decided I wanted to finally take a break, right? I'm always working. And I was like, no, I want to watch this Disney movie. I'm pausing for Disney. I'm watching Aladdin. Then I tried to be a magic carpet. So there went my health out of the door. But I'm good though. I'm still good. I would not trade that moment, that the moments leading up to it. I'll trade that moment for anything. But it was rejuvenating. It was rejuvenating, and we need human connection. Come on, right? COVID brought that home too. Human connection, whether it's on the computer or in person, we thrive based on that. It's how we thrive. So,
if it's okay, kind of coming back to this idea of taking the break, I think something else that we need to consider is a lot of us don't know how to take a break. A lot of us don't know how to relax. We are set up to work really hard and lots of hours. And I don't know about you all, but oftentimes there's work after work, right? We have charting and other things that we're trying to take care of. You know, if you're working in the university, there's papers to grade. There's just a lot of additional work outside of those traditional hours. And a lot of us go, okay, now I have this free time. What do I do? Right. There's this anxiety and this restlessness that we feel about trying to relax. We don't know how to do that. And I think, you know, I try to encourage other staff, even in our clinic, if you have PTO, you should take it. You know, if you have the time, you should take it. We need to take those breaks and feel like it's okay. Because self-care is important, but I don't think we talk enough about, well, what does that look like? How do I even do that? And I think as individuals, you know, we don't know how to do it for ourselves. We can help our family relax, you know, like we talk to our kids and do this, and we're taking care of everyone. But to slow down and really look at yourself and go, okay, I'm going to watch this Disney movie. I'm just going to stop. I'm going to check in with Disney, and then come back to the work. Right. Mm-hmm. But having that conversation early, what it means to relax.
Definitely. Thank you, Jen. All right. So
what it means to relax is get a housekeeper. You gotta get a housekeeper. And that helps a lot. all the time, but you know, you got to get a housekeeper. That helps me a lot to, whew. That's my take on it.
All right.
I agree.
Creating space for it,
Definitely.
right? You have to create the space for it. And I always say too, again, in my work in culture, I always think about just unlearning a lot of things that are really keep us oppressed, really, like, right? We should know how to relax. Like, and some of that might be, you know, spending some time getting to know who you are, right? Who are you today? Like, you're not the same person today that you were 2 years ago. Never mind, you can take COVID out of the picture. We're like different. We have different needs, right? Steveny, you run still, Steveny? Do you still run?
Hardly ever.
I was trying to bring you in for running. You know, maybe you take up a different thing, but whatever energy, whatever fueled you about it might be, you might get that fuel through another source. But it's really like, who am I? What do I need? I have affirmations all around me, y'all. You know, it's like, you know, be fearless in the pursuit of your goal. And these things, like those simple things are like, okay, pause, take a break. Even just to read that and remind myself of why I'm here. Appreciation journals, like what you appreciate about the day. Most people are not going to write that I worked 30 hours today, right? But you're going to write, wow, I had dinner with and just identifying that we already are doing it a little bit, but how much better we'll do when we have the fuel in our bodies to take those breaks. So, and it's quality, not quantity, y'all. It doesn't need to be 4 days. It could be 30 minutes.
I agree.
I would note when we're talking about wellness, I do wellness research, so pardon my bias, but the model that we use, or at least I use, is you know, a holistic model. So the notion of wellness as, you know, it's oftentimes, we're probably used to hearing a little bit broader version of it amongst them. So probably, but when I hear clients and students talk about it, so I was, well, I'm going to eat better or sleep better, and that equals wellness. And so, you know, wellness holistically, of course, is mind, body, spirit. You know, we've heard that, but a lot of times when we're thinking about wellness, you know, people are kind of coming at it from the standpoint of a deficit. And so wellness, we should be thinking about wellness as our assets. What are our strengths in all these different areas, and be focusing on those, because I hear that from everybody. But a lot of times it's so much about, I'm missing something. But we all know in times of distress, and certainly this last year, you know, particularly, it's all about what's been missing, but we forget about utilizing the strengths and assets that we have in the moment. And so that's what I try to kind of flip that on people when they're talking about all of these things that they're distressed about. We're going to talk about it. We're going to, you know, to Dr. Tashel, we're going to name it. We're going to talk about it. But let's not forget the assets that we've always used to maintain and strengthen our wellness.
Nice.
Thank you. So it looks like we're nearing the end of our time together. We have covered so much information. I just want to take this time for each one of you all to go around and provide a nugget or a clinical pearl, or even an affirmation like Dr. Tashel mentioned, with our audience for them to take away with them once they leave this webinar today.
Excuse me, Gracia, before they jump in, can I share resource from National Black Nurses Association, please? We will post this in our on our Facebook. Can you see what I'm sharing? We have the National Black Nurses Association has a reset mental wellness program at this website, and you can view webinars and podcasts over there to help you as a resource for mental wellness, what you need to do, how you can survive with all the stress of COVID. And then members of the National Black Nurses Association, they get 5 free confidential counseling services per diagnosis. And also there are crisis helpline that people can call. If you feel like you need help and you don't have anyone around, you can call 911 or National Suicide Prevention. If you're having bad thoughts, if things are overwhelming, you can call the National Suicide Prevention. The number for English is 1-800-273-TALK or 278255. And in Spanish, 1-888-628-9454. Thank you. I will let the panelists go on ahead now and wrap up with their final thoughts. Thank you everyone for coming.
Okay, I guess I will start. I think something that is important for me is to take care of yourself. And that means, like I say, I just work 72 hours. I need to work 80 a lot of times. I just keep it to that and I do okay, because I think that's my saving grace. Because sometimes on Fridays you're spent. Today I was spent. I did something really, and do something nice for yourself. It's been a long year and a half. Almost, tomorrow is May the 1st. And so when I came home, I was like, oh, I gotta do this webinar. I'm not really computer or just very well at this, because I don't do it a whole lot. But I will do more in the future. And then I was upset, like, oh, I gotta get this done. I gotta fix my face. And I haven't worn makeup in a year. But what I did is like took time out. I have a granddaughter, first time last year. That was the best thing about COVID. I had a granddaughter. So I took 15 minutes, just took her outside. Just like, Sonia, calm down and surround yourself with good people. You know, love yourself and your family. That would be my suggestion. Thank you. Nice meeting everybody.
Nice meeting you too.
So I can go next. I just want everyone to take from this webinar that, like LaSonya said, you know, self-care is excellent. I am very guilty of that. I don't do self-care for myself. I work 7 days on, and I'm usually off 14 days. And you know, that's my rotation. On my 7 days, I'm very busy. I mean, the turnaround time is very short, and I drive from Columbia to Jeff City. I have 3 boys. I had a baby during the pandemic, y'all. And, you know, my son just turned 1-year-old yesterday, and nobody's really met him. They're not going to meet him until he's probably starting to drive. And no, actually, I was just joking about that last part. But to be honest, it's like, you know, or family and friends that would usually share in that excitement, you know, for your newborn. I mean, you know, his aunts and uncles and, you know, friends and family just, you know, are not able to come by because of COVID. And so right now I'm preaching for everybody who's on here to get the vaccine, get vaccinated so you can have time with your family and go outside. There's so much to do outside. You can have, you know, 4th of July is coming up. You can have a barbecue, you guys, or you can have a cookout, or you can do something that families can do. And you know, the CDC is recommending that you now, if you have people in your family or friends that are vaccinated, fully vaccinated 2 weeks after you get your 2nd shot, right? So now you all can go without mask, right? So that's another reason to get vaccinated, because we can slowly but surely start to get back to what our post or pre-COVID life was. And I think for me, that is really gonna be helpful to be able to get, you know, just to see some friends again. And you know, guys, I mean, we greet each other by hugging, right? And so to just stay in isolation and stay afar and say hi, I mean, it's just not that feeling anymore. And it really does affect your psyche. So for me, it's get vaccinated, you know, encourage others to get vaccinated and try to get back to doing something that you guys love.
Thank you.
I would note real quick, I kind of gave my talk on the wellness piece, but, you know, focus on your assets as well. You know, do remember that, you know, we got here because we have a lot of strengths, and in stressful times, we tend to forget those. You know, so maybe take a minute and go back to thinking about what has worked for you and kind of maybe reapply that. As simple as that may sound, The other thing is that there's a number of just kind of in the moment techniques, and I'm sure Jennifer could list 100 more as well. You know, there's from different kind of theoretical orientations. There's solution focused of you know, what are some solutions to something? There are cognitive behavioral techniques that you don't have to have tons of therapy to do. You can just kind of learn the techniques and apply them because, you know, they're fairly easy to apply. Mindfulness techniques in the moment. There's several mindfulness techniques that you can apply in the moment. Grounding techniques, you know, breathing techniques, things like that you don't need a lot of time. And if you just have even a few minutes, you could, you know, take a second and try that too. So there's just a lot of different ways that you can utilize some quick techniques as well, kind of in the moment. And thank you for letting me be here. I've enjoyed it. Appreciate it.
Well,
I feel like piggybacking off of everybody. So I'm glad that we talked about some of the mindfulness as well. That's a big part of my background, a lot of the work I do with patients. And a simple thing that you can do when it comes to mindfulness is just think about your 5 senses. That's something we learned at a very early age. And you can do that anywhere that you are. Whether you personally have training in it or not, it's also something that you can teach your patients, right? Just the 5 senses. All of us can relate to that. You can practice it with them, even if they're in an exam room or an office with you. Very simple to do. I also try to remind people that in present moment awareness, it's also about recognizing the joy. It's there. It might be small. It might be just a moment. It might be that great sparkling water you're having or that lovely coffee, whatever it is, just taking that moment to be present and see the joy. A couple of other things I wanted to note off of conversations earlier too. I think it's important to validate the Black experience when it comes to hesitancy about getting vaccination. I try to do that with patients that are in my office, just as a means to go, you know what, it makes sense that you're feeling hesitant about this. When we think about Black experience with the medical community in the past and things that have happened, I think it helps build the trust. It's like, okay, like you're hearing me, you understand why I might be concerned about this, and encouraging them to just speak with their medical providers to get more factual information, and to speak with other people in their community too about their experience with vaccination. And the last thing I wanted to add into was about death and dying. I love this subject. I actually try to talk to my kids about it even now to reduce that fear. It's like I tell my kids, if my time comes, I want a wedding cake. I want somebody playing some Led Zeppelin. I want some Bob Marley. I want all these things. And I talk about it in this beautiful way, like something I'm looking forward to, almost like a birth, right? This beauty that's involved in it. And I think if we try to have that conversation early, we can reduce some of that fear when it gets to that moment, rather than, okay, here I am, I'm confronted with it. I have to make all these really quick decisions. I'm scared of it. I'm scared for my family member. Instead, starting those conversations early so we can build up that resiliency to deal with death when it comes.
Great point. Thank you,
Quick
Jennifer.
thing. Oh.
That's why we get social work and
Yeah.
to make that talk, because you guys are just amazing. Thank you.
Yeah. And I was going to add to that, reminding everybody that we're doing our best. You know, just some self-compassion that we're doing the best with the tools we have right now. No feeling is final. No circumstance is final. And we will get through it. Like, we're going to get through this. It's hard right now, but we're going to get through it. And for those who are dealing with loss and death and non-death losses, we see you, we hear you, we honor you. Death ends a life, not a relationship. I would encourage you to try your best to find ways to stay connected, even though this loss has happened. Through cooking your person's favorite recipe. I know some people will be hugging their grandparents for the first time on Mother's Day in a year, right? Or longer, or hugging their grandkids. And then some people, I think it's like 40,000 kids are without parents and grandparents this year, in a recent study, and disproportionately Black kids not just parent, but a mother, a parent, and a grandparent are coping with that. So again, being mindful of our language, take care of yourselves, and you're doing your best. And just remind yourself of that every day.
Thank you.
Thank you. Well, I guess it's my turn. Hi. Well, again, thank you so much for letting me be a part of this wonderful, very fruitful discussion. Thank you. That's one, I enjoyed my time. Two, again, the CDC website has a wonderful little thing on vaccine hesitancy and, real facts about the vaccines and, how they work and how they were done. And the bottom line, they are safe and effective. They're not perfect. Yes, they were done, fast, but a lot of it had to do with how they started making them while they were doing the studies. So that time was saved. We have to remind ourselves that so far, 237 million vaccine doses have been delivered, plus this is as of a few days ago. So again, it is safe, it's effective, it is our way out of this pandemic. And let's hope a lot of people get it so we can get our life back together, I hope. And thank you so much for this lovely evening. Thank you.
Thank you. I want to close it out and say thank you to all of our panelists. We appreciate your time, your expertise, and the information you brought to us today. To our attendees, I do want to let you all know that we are continuing to put on webinars on a monthly basis. I want you all to go to our Facebook page and like it and continue to follow us. We'll be putting out information about our next webinar soon. I do want to close out. We do have a poll for you all to take, and I want you all to have a great evening.